Arukah is a mental health and substance use center, but we have a really unique focus where we cover the continuum of wellness, treatment, prevention, and recovery services. Our rate of suicide was 63% higher than the state of Illinois. Our opioid overdose rates were much higher than the state of Illinois. We were seeing a lot of social determinants needs surrounding things, surrounding mental health and substance use that needed a solution where people could come into a place where they felt safe. They felt like they weren't going to be judged. There, unfortunately, was provider stigma. There's, unfortunately, was a lot of community-wide stigma surrounding mental health and substance use. Overdose reversals were at an all-time high. Our local police, fire, EMS, and private distributors of naloxone were giving out 5 doses every single day to save the lives of opioid users. We needed something that would provide a solution for these long-standing problems, these people that just kept falling into the cracks of the services that we had in our community. The HRSA outreach funding has been a catalyst for us to be able to build this innovative model of the living room. The living room is a statewide model in Illinois equipped to handle psychiatric crises. Within our Healthy Rural Hometown Initiative cohort, we were addressing the 5 leading causes of death, and our focus was unintentional injury due to substance use. Number 1 is to hire recovery support staff and to train them specifically in this method of crisis intervention and stabilization. We were able to provide resources and supplies that we needed for the living room to start it up, to get the doors open and to furnish it and to provide nourishment and harm reduction supplies and all of the things we needed to stock the living room with in order to do our job well. We also were able to hire clinical staff to pair with the recovery support staff to be able to provide this model. The living room is It's like a safe landing spot where people can walk in, and this is anyone in our community. This isn't just for people struggling with substance use or mental health. This is anyone, because we're trying to think upstream to treat, or to be able to intervene in some of the cases where people aren't at the level of needing treatment. And we're also trying to foster help for those that are in recovery. The peer staff that staff the living room along with the therapists are very compassionate, non-judgmental. They have a great bedside manner, if you will. So when people walk in, they're not judged. We can de-escalate them and stabilize them, but they might also need shoes. They might also need clothing. They might need hygiene items. They might need a snack. Another important component is harm reduction. So there are many people in our community that are currently in active substance use. We want to be able to provide safety for those individuals, regardless of whether or not they want to go to treatment. So if you see your therapist once a week, that means that 6 days out of the week, you're not seeing your therapist and you might be struggling. So the living room can provide that support. If you see your doctor, once a month, then there's a significant, part of the month where you don't have that medical support. You can come into the living room and get that connection, that support. The key to our impact in our communities is people helping people. We really try and say, here, I'll take you. We have vehicles. Let's go together. I'll take you and to help you with that housing application. I'll take you to help you get an ID card. I'll take you to help you in that first appointment with that new doctor where you don't know them and you're really scared about potentially being stigmatized because you have a substance use disorder.
So from the perspective of law enforcement, our officers, rather than having to struggle to find resources or care for folks, we know we have a place where we can take them and drop them off or connect them with folks that work in the living room. We have 24/7 crisis services too. And so those two things combined give our officers a lot of latitude with resources, as opposed to, the old way of doing things where you're dropping people off at the emergency room or, God forbid they've committed some minor criminal offense, they're getting arrested for something. It just prolongs or exacerbates the issue. Whereas here we're connecting them with services. We see our arrest rates go way down. And I would presume our emergency room visits have gone down significantly too. You're not talking at them, you're talking with them, walking with them as they're going through this. All the officers carry around a card in their pockets that has a crisis number on it. Our emergency rooms are overworked, especially in rural communities. We're closing hospitals all the time. And so to go in there and see how that staff is just overwhelmed with these kind of things coming in, and this isn't a put a Band-Aid on it and send them home things. And so part of our onboarding process now when we hire counselors and recovery support folks is they actually come right along with an officer to see how comfortable they are in that setting, and also so the officers get to know who the clinicians and counselors are that they're going to be dealing with when they make that call. We're confident in making those connections, knowing who we're, referring them to.